back to the Massage Warehouse Muscle Whisper series and videos. In today's video, we're going to be talking about a technique that I developed well over a decade ago called Transverse STR. And the reason for that is I found sometimes the application to be a bit too strong and invasive in the normal sense. This is a technique that helps to increase the bounce or glide in a tissue, and clients love it because they just feel it's such a good stretch without them being beaten up. So please do have a look. I do have a series online that has a course that you can do online that has about 70 videos in it that will help you to be creative and be able to apply this technique, or you can come along and do it in person with me. Either way, thank you for joining me, and I hope to see you in another video. Speak soon. Bye. Transverse was, its conception came about because of the difficulty of applying a longitudinal stretch to some of these muscles. For instance, you've got your hamstrings here, and the idea was that you applied your lock at some point in the belly of the muscle, thereby taking up becoming the new origin of the muscle. But the problem with that is that, first off, using my thumb in a big muscle, getting myself, even if I wanted to assist, I've got this leg, where is it going to go? And that was one of the main problems, and which kind of started to generate some thought into what other choices could I do to be able to make a change without damaging my thumb and without asking the client to become too involved. So I don't tend to use my thumb, especially in big muscles, because it just damages it. I do tend to use either fist, forearm, or assisted work in order to apply a lock. So in this position, I'm just going to show you the differences between active, passive, resisted, and transverse. So let's just take the active is when your client does the movement. So I'm going to ask Dan, can you hold that position for me? And then I'm going to try to, now the advantages to that is that he can control the movement and take it in the direction at the length that he feels the stretch, and he can control it so that any discomfort, he can control that portion. But in this is not the best choice when you're working with hamstrings, because if you're working, let's say you're just working fist, yes, you can get in there and sink, but he has activated this muscle. So that might not be the choice that you want to implement for the technique. So Dan, relax that into my hand. Now I want to soften it. The whole purpose of this is I want to soften the hamstring so it's not so strong. The next one is passive. So I am the therapist is the one that does the movement. Now I can soften up the hamstrings. I can get my fist in there. I can't really get my thumb unless I'm really strong, like I have really strong thumbs, but even me, who has the strong thumbs, I wouldn't use that tool. So I could do fist, I could do heel of hand, I could even come in there and do some elbow or forearm and then make the movement passively. I can do it so that there is resistance to it, so I can add my hand here. And what that does, it reciprocally inhibits the hamstring by getting the quads to activate so that this becomes a little softer. Dan, just gently push down on my hand, but just follow my hand a bit. So as you can see, I've got my client to engage before I actually did the lock and the movement, and then I can sink in here, take up my slack and push down, and off I go. Now, I could do it in that manner. That is one choice, and there are some advantages to doing it that way when you see in other videos why it's kind of nice to do a resisted movement, because it helps you control the area as well as it helps to soften the muscle that you are working in. Then you could do transverse. Now I'm just going to walk around the couch here so you can see what this is the position I actually would choose in this case. Now I can, again, use that same position and sink in and then push away and passively get the movement in this manner. Now I find that this is really kind of the easiest for me to do. I can also ask him to resist the movement, add a little bit. Now I'm going to roll you in, Dan, just like that. Good. Resist that a little bit, not a lot, just resist it. Perfect. And what that does is it gets him to focus elsewhere, so the area that I'm working on is left alone. So it's a thing, take up slack, and you can move them either resisted, active, passive. It's a fairly easy choice. As much as possible, I try to use the transverse work rather than the sort of the classical approach, which is longitudinal, you know, using digits that are unprotected. So consider again what body part you're working with and your various tools and choices, and whether you want to use active, passive, resisted, or transverse. We give you lots of examples in future videos, so this is just to give you an idea of the differences between the 4 choices. Thank you for joining me. Now, if you have any comments, please do leave them below. I might not get right away, but certainly we'll get to them as soon as possible. If you liked it, please do indicate that you did. And if you want to share it, I welcome you to do so. Otherwise, I hope to see you in other vids. And until then, ciao.